Now, eastern Afghanistan has been hit by a serious aftershock days after a devastating earthquake killed at least 1,400 people and injured thousands. The 5.2 magnitude aftershock hit on Tuesday near Jalalabad, which was the epicenter of Sunday's earthquake. Taliban officials say the death toll is expected to rise further as rescuers are struggling to reach mountainous regions.
The destruction in eastern Afghanistan is widespread. Thousands of homes have collapsed, and entire villages nestled in its mountains remain cut off. This hospital in Jalalabad has received a new wave of victims. The flow of patients has been non-stop, but many more are still trapped under the rubble.
These figures are preliminary and have not yet been finalized. The number of injured and dead continues to rise, and the injured are being brought here from 3 provinces.
Families are beginning to receive the bodies of their loved ones killed in Sunday's earthquake. But rescue teams are struggling to reach remote areas due to difficult terrain and landslides and rubble blocking the way. Helicopters are being deployed while local communities join the search for survivors.
Our staff and volunteers sometimes have to be walking for about 4 to 5 hours to reach some of those remote villages. And once they reach there, they have to walk back and bring those affected and wounded people into the city center. And the 2 hospitals there are overwhelmed with capacity.
The United Nations warns that hundreds of thousands of people may be affected by the disasters. Meanwhile, local resources are stretched thin after a sharp drop in international aid under the Taliban government. Families without proper shelter are left waiting for help, while a strained humanitarian system struggles to reach those in desperate need.
I spoke to Srikanta Misra earlier. He's the country director of the NGO ActionAid Afghanistan. And he told me more about the kind of help that's needed on the ground right now.
Yeah, thanks for having me here. We have a team working in both Kunar and Nangara, 2 of the most devastated provinces. And of course, the relief work has been started by different agencies, including the de facto, but many of the places are still inaccessible by road. So people are, either by, reaching out to far-flung areas, either by helicopter or by walk. So right now, the major requirements is around, medical support to the people who are injured and also psychosocial and trauma care, particularly for women and children who have been kind of most affected in this devastation. And also we are talking about food insecurity, which has been there in this part of the country, which has been historically known as the poorest areas. And of course, and then this devastation has further exacerbated that, food insecurity, water, and of course, and also around, loss of livelihood. Our estimate says that nearly 15,000 population have been directly hit by this, and out of that, 15,000 households have been directly hit. Out of that, 10,000 families have lost their livelihood, which is primarily dependent on agriculture and livestock and small-scale tradings.
The challenges must be huge that the organisations such as yours are facing to try and get aid to people in need. As you say, some of the villages can't even be reached. Can you tell us a little bit more about the kind of help that ActionAid Afghanistan is offering, as part of your emergency response, in particular for women and children, as you were mentioning?
Yeah. So, of course, for women and children, we are looking at, providing protection, hygiene, and caregiving supports to them. But we are looking at providing, hygiene kits for women, and it actually women and children together. So we have a family hygiene kits that we'll be supporting. We are also looking at providing ready-to-eat and dry rations, food kits, which will also include clean water, And that is the immediate support that we are looking at. And going forward, we are also looking at rehabilitating water, safe water points and other wash and sanitation activities there. Yeah.
Are rescue and relief efforts being affected in a way by the current political situation under Taliban rule?
Let's not talk about the political part of it. I'll rather concern more about the humanitarian part of it, because we have a bigger mandate right now to save lives and provide immediate assistance to the people in need.
What we do need to talk about, though, of course, is the Taliban's extremely restrictive policies on girls and women. We were just talking about that. Can I ask you whether women and girls are receiving the support and the protection that they need?
Right now, many organizations are actively pursuing that one, and then one of the focus, including of many NGOs, including ActionAid, is on providing support to the women and girls there. Yeah.
And so there's no differences in how women and girls are being treated in this situation in particular?
Right now, it's saving life is the most important thing. I think there is no resistance so far. We have received, at least from ActionAid side, I can say that we have not received any resistance or restrictions around that one.
All right, we'll have to leave it there. But thank you so much for joining us today, Srikanta Misra from ActionAid Afghanistan.
Thank you very much.